Every day, crews with Aurora Fire Rescue will make sure their medical gear is ready to go. From medications,
what we call our cardiac monitor,
to machines.
check the pads.
All the equipment that can help them save a life.
We can also cardiovert, which is, shocking the heart back into the rhythm.
One of the calls crews need to prepare for is cardiac arrest.
Cardiac arrest is really when the heart has stopped. Heart attack is more that there's a blockage of a blood vessel.
AFR Medical Director Dr. Eric Hill says cardiac arrest can happen to almost anyone.
After a few minutes of that, 3 to 4 minutes, you start to have brain damage, which can be irreversible.
In 2021, the average out-of-hospital survival rate in the U.S. was around 7%, according to the CARES database. AFR's numbers were double that, and in 2020, they were almost triple that year's average.
We know what the absolute best chance for them, from our perspective, that we can do is to deliver the absolute best CPR.
CPR. Dr. Hill says the department trains and retrains on CPR to make sure teams provide the absolute best care. While AFR is doing what they can to help the community, more lives could be saved with your help. With bystander CPR and better availability and use of AEDs.
You look at our response times, maybe we're averaging 6 minutes, but I just told you that 4 minutes is really time that brain damage is setting in.
Those are crucial minutes before crews arrive, and performing hands-only CPR can be life-saving. Dr. Hill also adds an AED can offer the same help, and the community needs more of them.
There's all kinds of things we can do as a community to get better and have better chances for our public to survive a out-of-hospital cardiac arrest.
So I mentioned the numbers from 2020 and 21. Well, Dr. Hill tells me in 2022, they helped save 26 people in cardiac arrest who then left the hospital and were able to return to their normal lives. Now, Aurora TV profiled some of those patients. If you remember baby Alexander, we also did a piece on dispatcher Julie McKay. She helped with 2 life-saving calls last year.
I remember the Phoenix Awards. The fire department uses them to honor the first responders whose care has made a difference in the case of a cardiac arrest. And then the Sim Man, that technology they're using to help crews in scenarios just like that. Always going above and beyond.
Yes, that Sim Man is so believable too. It's so real.
Very realistic.
Yes. Really fun on that story,
yeah. To, actually get good practice on it.
That's what makes the difference.
So if someone wants to learn CPR, Miranda, what should they do?
Yep, great question. Well, AFR can teach you. You just have to set up a class with them. And actually, once you know CPR, you can sign up to be a part of Pulse Point. It's a program in Aurora, and it'll alert nearby bystanders of an emergency they can actually help with.
Wow.
All of this information, all along with that CPR information, is linked to this story on our website.